Hello, I'm Dr. John White, Chief Medical Officer at WebMD, and welcome to Coronavirus in Context. Today, we're going to talk about coronavirus in the pediatric population, especially as it relates to our pediatric hospitals, our children's hospitals. My guest today is Dr. Anthony Sandler. He is the Surgeon in Chief at Children's National Hospital in Washington, D.C. Thanks for joining me, Dr. Sandler.
Thank you for inviting me, John.
What are we seeing in the pediatric population in terms of coronavirus? We've been hearing they're not affected as much as adults. Is that true? What are you seeing in the hospital?
So our experience so far has actually been quite favorable for children. We have had a couple of children who have presented here that have had coronavirus infections, but none of them have been admitted to date, which is very different to the adult and specially aged population.
Why do you think this might be different for kids? Do they have some type of natural immunity to coronavirus?
There's lots of theories and none are really proven. Children just may be less susceptible because of a difference in receptors to which the coronavirus can bind. But no one is really sure at this point, and we're happy that at least thus far, children have primarily been spared.
We've been talking about surge capacity. And is it different in a pediatric hospital than for an adult hospital? What is Children's National Hospital doing to ensure surge capacity?
So, one of the things that we've done in preparation for all of this is really limiting elective cases. Now, there's multiple reasons for that. An elective surgery is surgery that is neither urgent nor emergent. It's a kind of a lump and bump that needs to be fixed, or the belly button hernia or the circumcision, just something simple, really. And the reason we've limited that is because of the resources that are around that. We think there will be a surge from several perspectives. If we ran all our elective cases, then there would be tons of patients and families in waiting rooms, and that would increase exposure of potential infected patients or family members. And so what we call social distancing, this at least allows less people to gather in a certain area. At the same time, we do think that there will be a surge, and we also want to be open that if adult hospitals that care for kids cannot manage those children, they would send them and regionalize them to places like Children's National, where I work. That way we would open beds at adult hospitals so that we can take care of children in them.
I assume ventilators are different for kids. Are we having a different shortage in the pediatric population?
Well, hopefully we don't get the same surge. And if we don't get the same surge in the pediatric population, then ventilators will be fine. But we're still taking care of sick children, and we're taking care of them like we always do. And so there could be a significant stress on the hospital environment if we do get a sudden surge of patients.
Are you limiting visitors? Are parents still able to come see their kids? Are there limitations in terms of?
Yes, we're trying to limit 2 people to each patient. But that may change. We may start limiting to just 1 parent with a child.
Now, elective for parents and kids sometimes means different things that it may mean for you or me as a physician. What's been parents and their kids when they thought they were going to have a surgery, and now it's might be unclear when that's going to be done?
I didn't catch everything you said, John. I apologize, but I think from the perspective of an elective surgery that's necessary, but it's not necessary in the next month or 2 months. The child's lived with it their whole lives, and the child will do well until we get the opportunity to repair whatever needs to be repaired. There is an elective type surgery, which we are calling for the moment semi-urgent, and that's for a child who may have a inguinal hernia, but it's completely asymptomatic. Okay. Now, those inguinal hernias, for example, can become symptomatic, And when they start having pain or discomfort or difficulties around it, then those sort of move from a purely elective case to one that becomes semi-urgent and should be done so as to prevent the child from
Yeah.
presenting in the emergency room and just putting a bigger stress on the healthcare system.
What I was asking is, how are the kids and the parents responding, being told the procedure is being rescheduled?
They're responding very well. Of course, you know, it's everyone's unsure and everyone's a little concerned right now. Um, I imagine people feel that if they don't have to be in a hospital where there's potential coronavirus, you don't want to hang out there. And so I think the parents have responded very well and very understanding. And I think everyone realizes we're all in this together. And so everyone's trying to be a good citizen and help however they can.
How well are the pediatric hospitals prepared for any potential surge in cases?
So we're very well prepared. And by cutting out elective cases, by cutting down elective clinic visits, which are purely elective, we've cut down the number of patients in the hospital, which has created more opportunities for taking care of more patients. Having said that, the personal protective equipment, which is PPE, is somewhat limited, and we are somewhat concerned about that because we could run out of the personal protective equipment, which is essential for hospital caregivers so that they themselves don't get ill. We are prepared right now, we're stocked right now, everything is safe, but one hopes that this will not get out of control as we go into the next couple of weeks.
Do parents need to do anything differently right now? They're concerned about a symptom might be having. Do they not come to the hospital? Do they call their doctor first? Anything different to be doing in terms of coming to the hospital, visiting the hospital?
Yes, you know, if it's not really essential that they be in the hospital, it's probably a safer environment to not be in the hospital. Be at home, be amongst those you know and those who aren't sick. The concept of families getting hold of us is still the same as they've ever done. We're available by telephone. We're trying to do some telemedicine, trying to communicate. So we really still are actively engaged in healthcare, albeit maybe less so on a personal visit at times.
How are the kids doing with telehealth? Are they embracing it? They're probably used to it more than you and I.
Yeah, that's exactly what I was going to say. They're seemingly a lot more comfortable with it than we would be. They spend a lot of screen time, and now if there ever was a reason to do screen time, it's now. You know, the American Association of Pediatrics have suggested that parents limit the child's screen time, but I think everyone is allowing it more frequently during this period.
Thank you, Dr. Sandler, for spending some screen time with us today.
Thank you.
And thank all of you for watching Coronavirus in Context. I'm Dr. John White, Chief Medical Officer at WebMD. Thanks for watching.